Welcome to the PAWSCAST, and now here are our hosts, Mandy V and Tajay B.
Hi everybody. Today we're joined by Dr. Shawn Golden, and I'm Dr. Amanda Vanderveer.
And I'm Tajay Bolton, and today we're going to be talking about shame.
So we've all experienced shame at some point for something we've said or something we've done. We've all had those moments where, oh my gosh, I can't believe I did that. Or someone comes and says, hey, I know what you did. That was wrong. Like, so already the butterflies in the stomach, the feeling, the slightly sick feeling coming on. So what is happening when we're feeling all those pangs of guilt and shame and just, ugh?
Okay, so before we dive too much into that, I'd like to take a minute, if it's okay, to distinguish between some of the terms that will probably come up a lot today.
That'd be great.
Because I think a lot of times we overlap some of these terms and maybe even confuse their definitions a little bit. And they're important distinctions. So when we talk about shame, that is different than when we talk about guilt. And you may have heard of Dr. Brene Brown. She's done a lot of research on shame and vulnerability, and she distinguishes guilt and shame by essentially the very basic definition would be guilt is I did something wrong, and shame would be I am wrong. So where guilt is really focused on the behavior that we did, the shame is focused on us as people. So, and then that sometimes, those terms even sometimes get confused with regret. And regret is, there's a book by, I think Daniel Pink, called The Power of Regret, where he defines regret as an emotional and cognitive experience that occurs when a path we've chosen or a decision we've made did not have the most optimal outcome. So again, it's focused on the decision or the behavior, not the person and their worth. And regret, of course, tends to be past focused, and it can occur immediately after a behavior or a decision, or it can occur years and years later. So to hone back in on shame, because I know that's where a lot of our questioning is going to go today. Shame is damaging and hurtful to us, where regret and guilt can actually be helpful and motivating, which I know we'll get into in a little bit.
So, when you have, so personally myself, like sometimes I'll get flashbacks, and then I will be confused between is it shame or guilt of something that I did or something I may have said. So, usually when that happens, how do I know which one is which, from guilt or shame?
Okay. So let's be real, they're both uncomfortable,
Yeah.
right? And lots of our very natural human emotions are uncomfortable. And a lot of times we have this kind of natural desire to want everything to feel good. So whenever we have any sort of uncomfortable feeling, our immediate desire is to want to take it away. But that's, first of all, not realistic, and second of all, not necessarily the most helpful process. So one of the more helpful processes is to really explore that a little bit, which it sounds like that's what you're talking about, is, kind of doing that deep dive a little bit into our own experience and saying what's really going on here. So again, if you distinguish between guilt and shame, guilt, I did something wrong or I did something bad, versus shame, I am bad. That's it. So it really comes down to kind of the cognitive process we're having. Am I telling myself I'm a horrible person? I'm terrible, I'm bad, I'm worthless, these really hurtful kinds of things, or am I assessing my behavior? So again, even if we assess our behavior and we are ultimately recognize we're feeling guilt, it still doesn't feel good. But the process, or I should say the experience we have in our body even is different with guilt versus shame. Shame tends to be more limbic. It activates even the same kind of processes that fear does. that fight flight. So when that happens, it tends to shut down our cognitive processes, or at least it makes them less accessible to us. So we're not really thinking through things as clearly as we could or should. So before I go any further with that, I do want to take a pause and say we all experience shame. So it is not the goal of healthy functioning to get rid of shame. I don't want to put that out there to the world in any way, because it is a natural emotion. It is something that we all experience. If somebody tells you they have not experienced shame ever, they're either lying, which is the most likely, or maybe not intentionally lying. Perhaps they're just not as aware. They haven't done that self-assessment. Or there are some like certain types of brain injuries or neurocognitive disease that can cause us to not necessarily experience shame, or if somebody's truly a sociopath, which is rare, but a possibility. So shame is normal. It's what we do with it that can really kind of make us or break us, because it can become toxic to a point where it really, really impacts us.
That makes sense. So, do you think that in general most people experience shame in the same way? Like, are there different types of shame that we may feel?
There are different theories on this too.
Okay.
Which would take much longer than we have.
Okay.
But as I did, because I already mentioned Dr. Brene Brown, who I absolutely love her work. So I do tend to kind of gravitate towards what her research has found with shame. But there are others that, as I was doing a little deep dive into this, that I found that do have different theories, or some theories that kind of see shame as a spectrum of emotions, with guilt and regret and embarrassment and humiliation and those kinds of things kind of on that spectrum. I find that to be a little cumbersome, I guess, to think of it that way. It makes more sense to me, and especially in the therapeutic work that I've done, that these really are more distinct kinds of emotions. So with that, Dr. Brene Brown, she actually, in her book, Daring Greatly, she lists 12 different categories of shame. So I'll list them for the purpose of our conversation. I know we don't have time to go into each one of them in depth, but so these are more like categories of shame. She lists appearance and body image, money and work, parenting, family, so that's kind of motherhood, fatherhood is the third one, family, so the more broad family rather than just family of origin, parenting, mental and physical health, addiction, sex, aging, religion, surviving trauma, and being stereotyped or labeled. So you'll notice that some of these are more inwardly focused, where we might shame ourselves. Some of them are more outwardly focused, where we might feel shame from others, from society, from culture. And sometimes they kind of intermix, where we might perceive shame from external forces, and then we take it on and we internalize it. So it's a complex process. And again, though these are what Dr. Brown lists, there are other theories of different types of shame. But I think the other ones I've seen are more broad, where I think hers are more specific and probably would fall under those broad categories if we really kind of overlap them.
Yeah, that makes absolute sense.
So how does shame work with our relationship with people? Like, does shame affect our relationships with other people?
Without question.
Okay.
Especially if it is shame to a toxic level. So if somebody, I know we'll get into this in a little bit, so I don't want to jump too far ahead, but if somebody has really built resiliency factors around shame, and they have good awareness of their shame triggers, then then I would say that they're really insulated against having shame impact their relationships, because they're so aware of it and they can really account for that in their interactions with others. When we have that toxic shame and we don't have good awareness of it, then it can absolutely interfere with our relationships. Shame, in order to thrive, this is another Dr. Brene Brown, shame needs 3 ingredients: secrecy, silence, and judgment. So whenever we're kind of in that shame storm, and it's a cycle, shame begets shame. So, we have the initial shame, and then we feel ashamed for feeling shame, and it just, kind of snowballs from there. So because that shame, it almost becomes its own force.
Yeah.
And it needs to be silent. It needs silence in order to thrive. So we feel less available or less willing to reach out to other people when that shame is really intense. So it causes us to isolate from others, and maybe not necessarily physically isolating where we're just by ourselves all the time, but even when we're around other people, we're not letting ourselves really be vulnerable or available to those relationships. And what we know, again, from Dr. Brene Brown's work is that I love her. Her work really tells us that we need vulnerability. We need to be vulnerable. We need others to be vulnerable with us. That is what helps us develop empathy for each other. That is what helps us really foster, build, and nurture relationships, healthy relationships with each other. So when shame says, we're not going to do any of that, then it absolutely, it creates that barrier for us to really develop meaningful relationships with other people.
Yeah. And you mentioned empathy. We've done a wonderful PAWSCAST on empathy. Please feel free to check it out. But it sounds like shame can really affect how we view ourselves too.
Yes, absolutely. You can link many physical or mental health struggles, ailments with shame. Again, that kind of toxic level of shame, where it's increased depression, increased likelihood of developing addiction, increased likelihood of suicide. So many of our struggles can come from shame, and it can impact us physically as well. Just like depression and anxiety can impact us, because again, it's a cycle. Shame drives depression and anxiety, which then can drive those physical ailments. So we experience pain physical pain more intensely whenever we're kind of in a shame storm and in that toxic place of shame. So it impacts us in so many ways. Yeah.
Wow. So how do we conquer that unhealthy shame that you talked about?
So first is we really have to recognize it for what it is. And going back to what I said earlier, recognizing that it's okay. It's normal for us to all feel shame. There's not a button that we can push anywhere that can just make it disappear completely, even with lots of therapy, lots of attempts to try to eradicate it. We're not necessarily intent on getting rid of it. But it is important to be aware of it. That's the first thing we have to do, is be aware of what our triggers are. And that might be something we can do on our own. It might be something that we can do with some really supportive people in our lives that we recognize to be worthy of our vulnerability, if I can say it that way. And I draw that distinction intentionally because we do have to be careful with who we allow to support us in that way. You don't want to invite people into your life that are going to drive that shame storm even more than it already is. And sometimes we obviously don't do that intentionally, but it can happen. So that's why I say, in your process of raising your awareness, make sure that you're doing so with people who can be trusted. And that's also, I guess, that is the second ingredient, so to speak, is to invite other people into that process with you that you can trust. And if you just don't feel like you know in your own personal life who you can trust, that's maybe when it's important to seek out professional support and, you know, therapist, which of course now in the post-COVID age is available. You know, if somebody just doesn't feel like they can present in person for therapy sessions, you can do some online therapy. There are apps even that people can use, which I guess I'm just old school enough to prefer as a therapist the face-to-face because of how important that connection is. But for folks who maybe are really, really caught up in a shame storm and they just can't do that right now, that's a nice option for them. And the last piece is, and this also might require that support from others, to learn to talk to yourself the way you would talk to good friends or loved ones.
Amen to that.
Right?
Yes.
I know we are almost always our own worst critics.
Mm-hmm.
All of us. All of us.
Yeah.
And you would never say to a friend, a good friend, somebody you care about and love, whenever they're having a hard moment, they're, you know, sharing with you, oh my goodness, I just feel so awful. I stayed up late studying and my alarm didn't go off. I slept through my exam. I don't know what I'm going to do. I just feel like such a failure. You would never look at your friend and be like, what are you thinking?
Yeah.
Oh my God, you're horrible. Yeah, you don't even
You
deserve
that. That's what you
Yeah,
feel.
you're an idiot. What?
Yeah, you don't even deserve to be a student here. Why did they even let you in? And this is crazy.
Yeah.
Of course you wouldn't do that, but you know darn well you wouldn't talk to yourself that way.
Yeah, absolutely.
So it has to be an intentional process for us, and that's why if we can go back, you know, to the distinction between guilt and shame, where guilt is allows us to have a little more of a cognitive process, where shame just drives that limbic and intense fear and angst. When we're experiencing guilt, again, uncomfortable, but we can access that cognitive process a little bit better, where we can maybe initially we have that that unhelpful dialogue with ourselves. Oh, you're so stupid. What were you thinking? But eventually, if you can kind of pull back from that and go, wait a minute, you know, okay, this is, I'm human. I made a mistake. I forgot to set my alarm. You know, I was so exhausted. My body just kind of shut down on me. And we can kind of talk ourselves through the reality of it.
Yeah.
Because part of that, that dialogue has to be reality checking. So often our shame is driven by misperception. That we have told ourselves things that are just not true.
Yeah.
Or we have taken on the shame that really belongs to someone else. And that I see that especially in survivors of trauma.
Oh, yes.
Who feel immense shame about something that somebody else did to them. They did nothing, absolutely nothing to deserve it, nothing to warrant that. But yeah, they're the ones carrying the shame for it.
Yeah.
And oftentimes that again drives that, you know, I feel such shame. I don't have to tell anybody about it. I can't tell you when I was as part of my career as a psychologist across the years, I worked at FSU campus counseling center for 6 years. And in my time in the counseling center, I can't tell you how many people I had come in years and years after a traumatic experience, finally recognizing the importance of talking about it, but still having such a hard time, even in a safe, you know, as safe as we can make it, situation with, you know, a therapist who is bound by confidentiality, ethically and morally, who's not going to share anything, who's going to provide as much support without judgment, and still, people were so scared to really share. I had some folks that I would be in therapy for years, and finally, after years, they're able to share some of the details of their trauma. Again, the shame that they're carrying that is not theirs to carry. But that just, it goes to show how powerful it can be.
Yes,
Yeah.
absolutely. And And the really horrible part about that is the people that should be bearing the shame are probably not.
That's probably true. Yeah.
Yeah, yeah, absolutely. So you talked about how shame and guilt can maybe move us into a more positive direction. Can you talk a little bit more about that? Like, how can shame be something that motivates us?
Yeah, so I, again, and kind of keeping aligned with Dr. Brown's work, where again, if you do a little Google search on, the positive aspects of shame, you will find authors and theorists that identify, I guess, healthy shame. Being the lover of Dr. Brene Brown that I am, in her research, it really, she really found that shame is not a helpful process to us. Even though it's natural, even though we all experience it, it's not helpful. So it's something that we owe to ourselves to do those things that I mentioned earlier, to become aware, to do that reality checking, to learn to reach out for support, to talk to ourselves, learn how to talk to ourselves the way we talk to other people. So I will say though, after very clearly saying, I don't think shame is a good thing ever, don't do it to yourself, don't do it to others.
Right.
We can go into more detail with that if you would like. But to answer your question about guilt, and to kind of weave regret in there as well, because they're, similar processes. Those actually can, because they allow us to access the more cognitive processes. That's where we really need to be in order to kind of work through some of the hard feelings that come up for us sometimes. They can be helpful to us. So they're, especially if we're using them the right way, it can increase our motivation to follow paths that seem more authentic to us.
Yeah.
It can decrease our likelihood of doing things that don't align with our values, where maybe I felt guilty because I cheated on a test, when I was younger, and now that 20 years later, I'm never going to do that again because I know how guilty I felt in the aftermath of it. And you could call that regret as well. So those can really help us kind of bolster our values, where shame just kind of drives us internal and leaves us feeling worthless and helpless. And shame, just by its definition, it doesn't allow any growth. Or change, and as part of our human nature is we grow, we change based on our experiences. And shame being I am bad, it doesn't allow for that. It's just a label, boom, there you are, that's all you'll ever be. So guilt and regret, those kinds of processes allow us to find that motivation to foster that positive growth and change that we all hopefully experience through life.
Yeah, that makes complete sense, because when I'm feeling shame, I am feeling that kind of sort of sick feeling inside of me.
Yes.
I'm not necessarily thinking clearly, but when I get some distance from that and I can start thinking about, what were my actions, what can I change for the positive, that's when I'm coming into maybe the guilt and the regret and learning from that process.
Yes, absolutely, yes. So in one of her books, I think it might be Daring Greatly, but I can't remember. All of Brene Brown's work just kind of melts in my head together after a while. But she pulled, I think it's from Jungian psychology, the definition of shame being the swampland of the soul. And then she kind of goes on to expand on that, saying, yes, that is what it is. And you don't want to build a house and set up shop there.
Right.
And that's really that toxic, that would be kind of an imagery, I guess, of that toxic shame, where you just live in it and you allow it to truly tell you that you're worthless. But it is important because we can't get rid of it, because it's there. it is important to learn how to wade through it, how to go into it for a little bit and recognize, because that process you just described would not have been possible if you didn't sit with that for a moment and go, oh my goodness, I'm having these physical experiences right now based on this dialogue that I'm having in my head. What's going on? So you have to spend enough time there to recognize this is shame, and know that that's not a helpful process. So then you can kind of put your galoshes on, wade through that swamp a little bit, and make your way out on the other side without, building up shop and staying in it. But that's easier said than done, of course. It's easy for me to talk about doing that, but it can take, for folks who have really been in that process for a long time. Think of somebody who maybe had guardians, parents in their or others in their life that used shame as a tool of discipline or behavior modification. And even though it starts external, especially with children, it can easily internalize. Yeah. And then it becomes a way of life. And I'm not saying this happens to everybody. We are all different. Let's, put that out there. But I've seen it play out a lot in therapy, where folks are coming in as college students or even older. I work with other, folks in the community now that are, well beyond that age range even. And as we go through therapy, it becomes clear to both of us eventually that this person has been sitting in toxic shame for a long time. And so then it becomes a process, and it doesn't, if it's been 20, 30, 40 or more years that somebody's really been sitting in that, it doesn't happen overnight where you just go, okay, let's talk about how to minimize this shame, how to wade through the swampland rather than setting up shop in it. And then all of a sudden they go, okay, all right, I got this now. It's just not that easy.
Right.
But it is a start. It's the start of the process. So I encourage anybody who's recognizing that might be going on for them, especially if it's chronic and toxic, to really seek out that kind of support. It is really hard. It's so hard to overcome that toxic shame all by yourself. And remember, in order to really overcome it, we need to connect. We need to reach out to other people. And the reason that's important is it helps us recognize we're not alone. Because the shame tells us we're terrible, we're bad, and we're the only person who does this.
Nobody will ever love me.
Yeah.
Yep.
And I'm the only one who has ever done something like this. I'm the only one who's ever experienced this. Nobody will understand me. And the reality is, we all get it. We really do. Even if some people aren't willing to talk about it, we've all been in a shame storm. We've all felt it. So whenever we reach out to somebody who can be trusted, that's an opportunity for us to kind of have that little bit of purge for ourselves, but then for them, the other person to be able to say, oh my gosh, me too. I've been there, I felt that, I'm so sorry. And that there's so much healing in just having that kind of experience.
Yeah, that makes sense.
I'm so happy you mentioned that, because I was just going to ask you why it's so essential to treat yourself when you're dealing with pain rather than ignoring it. You also mentioned something that I wanted to ask you about. Is it often that people confuse embarrassment with shame?
I would say yeah.
Yeah. I feel like sometimes I even mess it up myself when I feel like, I trip, and I'm like, I'm so ashamed, I can't believe I fell in front of these people, but maybe it's just, just a little embarrassed, it's okay. Like,
right.
Move on, check it out.
Yeah. And where again, shame is I am bad, I am broke, and something is inherently wrong with me. Embarrassment, it's a little something happened that, of course I didn't like it, it's not the outcome I wanted, it's uncomfortable, but it doesn't mean I'm broken. But yeah, we can, and so often, even if we're feeling the accurate emotion, we might mislabel it. That happens all the time. You might say I'm so ashamed when actually I'm embarrassed. Or I'm feeling guilt, but I'm calling it shame. It's so easy to do, and I think I don't think I had an appreciation for this when I first started as a therapist, but the further I go and recognize the importance of communication, I think it's really important for us to know how to label our emotions well.
Absolutely.
There are over, last count I paid attention to, 400, I believe, identified emotions in the human condition. And if you ask people off the cuff to name them, they can usually name maybe 3 to 5.
Yeah.
Happy, sad, mad, scared.
Can't even get through the
Anxious.
7 awards.
Anxious, yeah, that's about it.
Yeah.
But there's so many, and there are minute distinctions between them, and because our interpersonal interactions are so critical to the healing process for a lot of these really hard emotions, shame in particular, it's really critical to be able to articulate it well and to share it with other people. And that's not to say that we can't get benefit from sharing it, even if we're not quite sure what to call it, but that can be part of the process too. Like, help me identify this a little bit. Here's what I'm feeling. Here's what's going on in my body, but I don't even know what to call it. Yeah.
That conversation is so important to give those minute distinctions that you were talking about between different emotions or different feelings, because a lot of us, myself included, don't really understand the difference, because we will group shame, guilt, and embarrassment all in the same pool, thinking it's the same thing, and it's not.
Yeah, definite distinction. Like I said, there are some theories that would kind of put those maybe on a spectrum. I just have a hard time with that, because shame just feels so toxic to me that I don't even want to link it with the others, because I kind of want it to be over here in its own category, because as we talk about, guilt and regret can have benefits for us whenever we feel those pangs. But shame, not so much. And again, I haven't fully explored those theories that put them on a spectrum, but they're a little bit older than Dr. Brene Brown's work, so I tend to kind of gravitate in that direction, and it makes more sense to me based clinically on what I've seen in therapy with folks.
So how can we help people that we see they're living in a shame storm, and how can we help them? How can we try to encourage them to seek help or to get out of that?
Yeah. First of all, recognizing it's easier said than done,
Yes.
as we've already talked about. So
I think frequently when I'm talking to someone in the midst of it, I'll try and put the truth out there, like if they're saying, oh, I'm such a horrible person because I did this and I screwed up royally and it's the end of my world, I'm trying to motivate them, like, no, it's not, it'll be okay. And they're like, no, you don't understand.
yeah.
Well, okay.
Right. And I would say somebody in that moment, they are really locked into that shame storm, and they may need to experience it for a little bit, just to kind of go through that natural process. And so, like I said before, it's okay for us to be in it for a while. We just don't want to live there.
Yeah.
You've got to recognize when you've kind of had your moment and it's time to really start to move towards the other side of the swamp. So that's where good friends can come in. So if you're trying to, like, oh no, that's not true, you're a great person, you're so smart. You're trying to give all of these validations and doing that reality checking with them, and they're continuing to resist that. I roll with that resistance a little bit, and just kind of sit with them in that. Like, wow, this must be really hard. I'm so sorry. Oh my goodness, is there anything I can do? I'm here with you. And sometimes it might just be sitting silently as they're crying or having an emotional experience, saying things that are, I'm sure, hurtful to you as a friend to hear. Because I know as a therapist, when I would have people in my office saying all these really awful things about themselves, it hurts. I mean, it hurts to sit with somebody who's doing that.
Yes, it does.
But it's also hard for them in that moment to stop it. So if you think about, I'm gonna date myself here a little bit. But back when I was a kid, there were, I don't even remember what we called them, but on the playgrounds, they would have, these things that you would sit on and somebody would just spin you, really fast.
Oh, like the wheels and tires?
Well, that's a more modern version, I think, yeah,
Okay.
but these were like big metal things and they had bars and
Little
you would,
merry-go-round?
yeah.
Okay.
So whenever, you're on that, somebody's just
It's like
spinning you
swearing
really
really
fast.
Death traps that go in the circle.
Oh,
Yes. They're frightening, and I'm thankful that they're not on playgrounds anymore for my children's sake. But when during my childhood era, you'd get on those things, and usually an adult would just be spinning, and you're starting to feel sick. You've got all those uncomfortable feelings, and you're like, stop now. It doesn't. And the person, even if they try, now sometimes you've got a real a real stinker of a person who's just going to keep spinning you faster. But even if the person is trying to be helpful and they're stopping it, they're trying to grab and stop it, it doesn't stop on a dime. It still takes a little bit of time. So if you think of somebody in their shame storm as on one of those merry-go-rounds, they're spinning, and even though you're kind of grabbing at it, to try to help them, it's just going to take them a little bit to get out of that. They need their time.
Yeah.
So just sitting with them and trying to support them, and not necessarily trying to give them all those validations just yet, because it's actually kind of hard to hear them. You don't believe them. I mean, that's the reality. When you're really in that storm, you don't believe it.
You don't even want to hear it.
Yeah. No, I want to feel like I'm a terrible person in this moment. And I've done that to myself too, where I just need to feel it. I do. And then, you get to a place where you can go, okay, I need to move beyond this now, because I can't let it interfere with my relationships or my functioning.
Right.
But I needed to feel it for a while. So, be a friend, but don't necessarily try to try to just validate. But there might come a time where those validations can be helpful.
That makes sense.
Yeah.
So what about the support in the community? Not really campus-wise just yet, but just out in the foster community, outreach community. What kind of support or resources are out there for people who may have troubles dealing with shame?
Yeah, so I'd say any trained therapist should be able to work with shame. It's not necessarily a specialty kind of field. So any of the resources that students would use for therapy for anxiety or depression or just adjustment issues, they could really go to as well for shame. Of course, I know we're looking community-wide, but I know obviously the counseling center at FSU would be a good resource. For those that maybe aren't quite sure where they are or how this impacts them, because again, a lot of times this is a very kind of subconscious process for a lot of people, so there's not a lot of overt awareness about it. But if they're listening to this podcast and they're just intrigued, then they could read some of the books I've mentioned by Brene Brown. Daring Greatly is especially the one that's focused on shame, but all of her books are fabulous. And there are some, I don't have names of them, I apologize, but there are some apps that help with I would say cognitive distortions, the unhelpful thought processes that we have that sometimes drive shame. Now those are going to be more broad. I haven't really seen one that's specifically focused on shame, but just getting at those cognitive processes can be helpful in general, getting people more aware of how they talk to themselves. So if they're not quite sure they want to reach out to a therapist, or they're not even sure they want to talk to a good friend about it at this point, maybe just looking for some of those resources in the Dr. Brene Brown's books, or some apps online, even honestly doing a YouTube search for some of Brene Brown's. She's got a bunch of videos as well. If somebody doesn't want to read the book, they can just listen to some of her videos, but just, again, raising that awareness, because that's going to be the first piece of it. If somebody's not really aware that this is happening, they just know they're really uncomfortable, they might not recognize the importance of reaching out to somebody else. So hopefully, just putting this out there the way that we are will help some folks recognize, maybe this is an interesting thing to look into.
Yeah. Do you know of any resources that would be available to campus students?
As I mentioned, obviously, the FSU Counseling Center, the SAFE office would be a good place to come to either find some resources or at least ask where there might be other resources on campus. They have a lot of information about a lot of health-related areas.
Yeah.
So those are the two big ones off the top of my head. Some people find some comfort in reaching out to clergy or in other religious aspects. I would just give the caveat that for some folks, it's important to know that depending on the beliefs, depending on how it was presented to them growing up or even in their adulthood, sometimes religion can drive shame.
Yeah.
I'm just going to call it what it is, and that is not a criticism. It is not a blanket statement,
Yeah.
but it is real. I've seen a lot of folks come in to therapy who have grown up in church families where there was a lot of judgment, and it drove a lot of shame in them, and it took a while to really undo that process as an adult.
Yeah.
So that being said, that's not everyone's experience. For some folks, church families or other kinds of religious beliefs can really provide comfort and that connection
That's how it should be.
with something bigger than them. And just like connection with each other, with other people, is really critical to that. Connection to something bigger than ourselves can also be very important in that as well,
Absolutely.
if done the right way. Yeah.
Yes.
I like that.
Absolutely. Yeah.
Before we wrap my favorite podcast episode up, is there anything or any topics that you feel like we missed that you would like to touch on briefly?
Oh goodness, we could go on for hours and hours.
I think we could.
I don't feel like there's anything obviously missing from our conversation. But yeah, it's been wonderful. Thank you so much.
Well, we want to thank you for your time and for taking the time to present for us and sharing some of your knowledge with us. We are very, very happy with being able to share about shame and talk about it, because I think that's part of it. Like, it's really a taboo in our society to talk about. So being able to talk about it and open up about it, I think it's super helpful for a lot of people. So if anybody's interested, if you want more information, please check out our resources that we're going to have listed on the page, and also consider checking out our other PAWSCASTs too. And absolutely, please, anytime, stop by the SAFE office. We're here to help you guys. So, bye everybody. Thanks for watching.
Thank you.
Thank you for being a part of our PAWSCAST. This Health and Wellness podcast is brought to you by the Prevention Center and Peer Education Network at Frostburg State University. If you would like more information about our programs, visit us in Pullen Hall 109 or call us at 301-687-4761. Or you could also send us an email at safeoffice@frostburg.edu.